This is the second video of the series Quality Improvement Workshop, in which we will give great emphasis to the first step in Focus PDCA, that's find a process for improvement, in which we will explain how we choose a problem that could be acted upon and results in the required improvement. For more videos, visit my Facebook page, Healthcare Quality. Process variation. Understanding the variability of processes is a key to improving quality. In healthcare, there are uncontrollable variations related to differences among individuals, organ systems, or diseases. Issues of patient compliance, practitioner techniques, and influences of comorbidities must be understood in order to account for them and accommodate them. Variation in clinical practice has been defined in the past as the art of medicine. In fact, variation can be either positive or negative. Now payers and patients both are saying less art and more science. It is true that all processes vary, and no process functions exactly the same way over a period of time. So how do we meet the demands for accountability and improvement when processes always vary? First, we must understand the variation. According to Walter Shewart, process variation is of two types: random or common cause, and assignable or special cause. Random or common cause. It's intrinsic to the process itself, naturally occurring noise in the process, and also called inliers. For example, patient response to medication will always vary within the cohort of patients and even for one patient over time. Common causes refer to situations usually within those patient care systems and processes that are more ongoing, chronic, and persistent. These common causes may contribute to what is considered to be normal range of variation within a process. The goal of quality improvement is not to eliminate, but to reduce variation in a process enough to produce and sustain stability. Usually finding and resolving common causes of problems or variations is more time consuming and may be more difficult for departments, services, or quality improvement teams. The resolution of common causes of problems is often considered to be key, however, to continuous incremental improvement of the quality of care and services rendered to patients. This is also called the gold mine of quality. Assignable or special cause. It's extrinsic to the usual process, related to identifiable patient or clinical characteristics, idiosyncratic practice patterns, or to other factors that can be tracked assigned to root causes. Special causes are usually more easily identified and resolved, either by departments or quality improvement teams. For example, yesterday in ER there was a problem due to cut of water supply. Positive variations should be also analyzed for possible replication as better or best practice. Find a process or a problem that needs improvement. Problems for improvement are continuing problems present for a long time, not a recent specific episode. To be certain that quality improvement methods could solve your problem, ask yourself the following questions. Are we trying to reach a new level of performance for an existing process or service? Do we have measured or at least measurable specific deficiencies or opportunities for performance improvement? Are we trying to find and eliminate the root causes of a problem? If the answer to each question is yes, you probably have a problem for improvement. On the contrary, if you answer yes to the following questions, you probably do not have a quality improvement problem. Do we want to develop a brand new process? Are we establishing standards and measuring performance against those standards? Are we installing or implementing some specific equipment or procedure? Criteria for describing the problem. An effective problem description is: number one, specific. It explains exactly what's wrong and distinguishes the deficiency from similar problems. Number two, observable. It describes visible evidence of the problem. Number three, measurable. It indicates the scope of the problem in quantifiable terms by answering how much, how many, or how often. Measurement is important for two reasons. First, it helps to determine whether the problem is large enough to justify attention. Second, if the project goes forward, it provides the criteria for evaluating the remedy. If no measurement exists, they should be developed by the quality improvement team before the team begins to diagnose the root cause. Number four, the problem should be manageable. A manageable problem is one that can probably be solved in 6 to 12 months. If a problem is too large, it should be broken down into several smaller, more manageable projects. An example: our average length of stay for total hip replacement surgery is 1.2 days longer than the average for other hospitals in the area. This statement is specific. It names a particular procedure and the length of stay. It's observable. Evidence of the problem can be obtained from internal and public reports. It's measurable. Length of stay is measured in days. And manageable. The problem is limited to length of stay for one procedure. Describing the objective. An effective mission statement also indicates the objective of the project. That is, what the project team is to do about the problem. Example: the last problem objective is to reduce the length of stay for total hip replacement surgery to the best in the area. The project team's objective depends on what the organization wants to accomplish. In the example above, the objective was fairly easy to determine, but that's not always the case. In preparing the mission statement, a quality improvement committee selects that aspect of the problem that's most important to the organization. Consider the problem below and the three alternative objectives. Notice too that each objective might call for a different remedy. Too many X-rays are being retaken. On average, 8% of all X-rays must be taken a second time, resulting in higher costs and radiation exposure for our patients. Objective 1. Reduce the number of X-ray retakes. Objective 2. Reduce the costs of X-ray retakes. Objective 3. Reduce radiation exposure to patients resulting from X-ray retakes. Objective 1 might be met by eliminating many inexpensive X-rays, and Objective 2 might focus on eliminating the most expensive X-rays. But Objective 3 might eliminate fewer retakes and save fewer dollars while reducing patient exposure. The choice among these objectives will depend on which concern is most important to the organization. Pitfalls to avoid. A mission statement should not imply a cause, suggest a remedy, or assign blame. Examples of quality improvement problems. A blood sample drawn for a lab test clots and must be redrawn. A patient receives the wrong meal. A patient receives the wrong prescription. Essential instruments are missing on an operating room procedure tray. Patients are not seen until long after their scheduled appointment times. Medical records are not available when needed. An operating room is not ready for a scheduled procedure. If symptoms like these occur on an ongoing basis, they signal chronic underlying quality problems. An effective problem description is specific. It explains exactly what's wrong and distinguishes the deficiency from similar problems. Observable. It describes visible evidence of the problem. Measurable. It indicates the scope of the problem in quantifiable terms by answering how much, how many, or how often. Evaluating projects. After nominating projects, each need to be evaluated objectively in terms of potential impact on retaining customers, attracting new customers, reducing the costs of poor quality, enhancing employee satisfaction, and we can arrange these projects according to their priority and start working on them by their sequence. Thank you.